Welcome to Medicare Mondays. This segment is pre-recorded and we will be discussing Medicare Advantage supplemental benefits. What are supplemental benefits? A supplemental benefit is an item or service covered by a Medicare Advantage plan that is not covered by original Medicare. These benefits do not need to be provided by Medicare providers or at Medicare certified facilities. Some commonly offered supplemental benefits are dental care, vision care, hearing aids, transportation, or gym memberships. Supplemental benefits can be optional, which means they are offered to everyone enrolled in the plan. You can choose to purchase coverage if you want, for example, an optional dental benefit for which you can pay an extra premium. Or they can be mandatory, which means they are covered for everyone enrolled in the plan. For example, a gym membership benefit that's included in the plan. You don't pay an extra premium and you can't decline or opt out of the benefit. Mandatory doesn't mean you need to use it though. What supplemental benefits may be available to me if I have a chronic illness? Medicare Advantage plans can cover supplemental benefits that are not primarily health-related for beneficiaries who have chronic illnesses. These are sometimes called special supplemental benefits for the chronically ill, or SSBCI. SSBCI can address social determinants of health for people with chronic disease. A social determinant of health is a part of someone's life that can affect their health in some way, such as not having access to transportation. This can also include meal delivery, transportation for non-medical needs, home air cleaners, pest control, heart-healthy food or produce. To be eligible, you must be chronically ill. If you meet the criteria, a Medicare Advantage plan may offer you one of these benefits. Have at least one medically complex chronic condition that is life-threatening or significantly limits your health or function, which can include cardiovascular disorders, diabetes, chronic lung disorders, neurological disorders, chronic heart failure, chronic and disabling mental health conditions, cancer, dementia, chronic alcohol or drug dependence, autoimmune disorders, stroke, end-stage renal disease, severe hematologic disorders, end-stage liver disease, and HIV or AIDS. You have to have a high risk of hospitalization or other negative health outcomes and require intensive care coordination. What questions should I ask a Medicare Advantage plan about supplemental benefits? You might be interested in a plan that offers these supplemental benefits. If so, learn as much as possible before enrolling in the plan. It's important to know exactly how a plan's supplemental benefits work before signing up. Make sure to document calls and get information in writing. Ask questions like, is this an optional benefit that I need to sign up for? Do I need to pay extra for it? Is the benefit only for people with chronic conditions? If so, do I meet the criteria? Are there limits to how much I can use the benefit? Are there restrictions on where and how I can access these services? For example, do I need to see in-network providers or get a referral first? Is this the most cost-effective way for me to access these services? Do the other parts of this plan's coverage, not just the supplemental benefits, work for me? Are my providers in the plan's network? Does the plan cover my drugs? What kind of vision care is covered by original Medicare? Routine eye care services such as regular vision exams are excluded from Medicare coverage. However, Medicare does cover certain eye care services if you have a chronic eye condition, such as cataracts or glaucoma. Medicare covers surgical procedures to help repair the function of the eye due to the chronic eye conditions. For example, Medicare will cover surgery to remove a cataract and replace your eye's lens with a fabricated intraocular lens. Eyeglasses or contacts if you had an intraocular lens placed in your eye after cataract surgery. In this case, Medicare will cover a standard pair of untinted prescription eyeglasses or contacts if you need them. If medically necessary, Medicare may pay for customized eyeglasses or contact lenses. An eye exam to diagnose potential problems. If you're having a vision problems, eye pain, or other symptoms that may indicate a serious eye condition, Medicare will cover an exam. Your exam is covered even if it turns out you do not have a vision problem. What kind of dental care is covered by Original Medicare? Medicare does not cover dental services that you need primarily for the health of your teeth, including, but not limited to, routine checkups, cleanings, fillings, dentures, which mean complete or partial bridge, tooth extractions, having your teeth pulled in most cases. Limited Medicare coverage. While Medicare does not pay for dental care needed primarily for the health of your teeth, it does offer very limited coverage for dental care needed to protect your general health. Medicare may cover an oral examination in the hospital before a kidney transplant, an oral examination in a rural clinic or federally qualified health center before a heart valve replacement, dental services needed for radiation treatment for certain jaw-related diseases like oral cancer, ridge reconstruction, reconstruction of part of the jaw performed when a facial tumor is removed, surgery to treat fractures of the jaw or face, or dental splints and wiring needed after jaw surgery. What are other ways that I can access similar services? There are alternatives available if you need to access dental, vision, and other services that Medicare does not cover. These options may be useful if you prefer Original Medicare or if there are no Medicare Advantage plans in your area that cover these services and meet your other health care needs. For example, Medicaid is a federal and state program that provides health coverage for certain people with limited income and assets. Private plans, which you can purchase separate, a private plan that may cover certain services that Medicare does not cover. Medigaps, generally Medigaps, which are Medicare supplementary insurance, only pay secondary to Original Medicare in cases where Original Medicare covers a service and pays primary. Reduced cost or free clinics. You may be able to access the services you need through a free or reduced cost clinic in your area. You can use resources available at needymeds.org, healthcare.gov, freeclinics.com, and hhs.gov for more information. You can also access donated dental service programs through dental schools. These donated dental service programs operate in some states. Dentists in these programs offer free dental services to those who qualify. What is market and misrepresentation of Medicare Advantage supplemental benefits? Medicare has rules about how Medicare Advantage and Part D plans can contract you and market their services. It is a marketing violation to mislead Medicare beneficiaries when selling private plans. Marketing misrepresentation is a type of misleading marketing. The following are examples of marketing misrepresentation of Medicare Advantage supplemental benefits. An advertisement for the plan says that you would have access to the plan's transportation benefit to help you get to appointments, when this benefit is not available to everyone, only to enrollees with chronic conditions. An agent tells you that your eye doctor is in network for the plan's vision benefit, when you later learn that the doctor is not and never was in the plan's network. An agent claims that the plan's dental benefit covers fillings and dentures when it only covers regular cleanings and x-rays. An agent claims that Medicare covers hearing care, including hearing aids. Medicare doesn't cover most hearing care, and hearing aids can be bought over the counter. If you feel you have experienced misleading marketing, save all the information such as the agent's business card, messages, marketing handouts, or other contact information. You should report this to your local Senior Medicare Patrol, or SMP, or State Health Insurance Assistance Program, SHIP. Your SHIP can also help you switch plans if you enrolled based on misleading information. Who can I contact to learn more about Medicare Advantage supplemental benefits? You can reach your State Health Insurance Assistance Program, or SHIP. Your Rhode Island SHIP can help you learn about your coverage options and local resources. You can call 1-888-884-8721. You can contact your Senior Medicare Patrol, or SMP. Call your Rhode Island SMP if you believe you have experienced a hearing aid scam or other potential Medicare fraud, errors, or abuse at 1-888-884-8721. You can reach your Medicare Advantage plan. Contact the specific plan to learn about its supplemental benefits in detail. Ask lots of questions and get answers in writing. You can use the Administration for Community Living, or ACL, Elder Care Locator to learn about other resources in your community. Visit www.eldercare.acl.gov. If you need help with Medicare and supplemental benefits, contact any one of our community partners listed here. Agent Well in Woonsocket, Johnston Senior Center, West Bay Community Action Agency in Warwick, South Kingstown Senior Center, Westerly Senior Center, Rhode Island Aging and Disability Resource Center in Providence, East Bay Community Action Agency in East Providence, Leon Matthews Senior Center in Pawtucket, Progresso Latino in Central Falls, Edward King House in Newport, or you can reach the Rhode Island SHIP and SMP line at 1-888-884-8721. Thank you for viewing this presentation. If you have any questions, please feel free to contact 1-888-884-8721, or you can reach Jennifer Reyes, the SHIP and SMP Volunteer Coordinator, at jennifer.reyes@oha.ri.gov.